Stakeholders in the health sector have drafted 4 legislative proposals that, if enacted into law, will provide efficiency in service delivery and safeguard personal health data. The proposed bills constitute vital components of a broader strategy aimed at advancing universal healthcare coverage in line with Kenya Vision 2030.
Stakeholders from health sector led by Ministry of Health met in Nairobi to discuss legislative proposals that seek to support universal health coverage in the country. They concluded drafting of 4 bills that, if enacted, will see establishment of a comprehensively funded primary healthcare system that includes promotion, preventive, curative, palliative and rehabilitative services.
The other thing that is important is a prevention agenda, because prevention agenda is a main agenda for this government. And why it's a main agenda is because the way we have been working and addressing the healthcare needs of Kenyans is we wait for them to get sick, then we treat them. It is a firefighting system. Now, what we are trying to do with this primary healthcare bill is move from firefighting to fire protection.
The Ministry of Health is spearheading digital transformation within the sector as part of efforts to achieve universal health coverage.
The data governance framework says that all health data in Kenya is a national strategic asset. So all health data should at some point find itself in the national data bank in the form of the minimum data set, And that's what we're calling the shared health record.
What we are saying is that the digital ecosystem is interconnecting the households, the facilities and all the aspects of the healthcare system to make sure that it's possible to interact seamlessly between the payer, between the provider, between the patient, between any other player that is working within the healthcare ecosystem. So that is why the digitization component becomes very important.
If approved by Parliament, the Primary Healthcare Bill, Digital Health Bill, Facility Improvement Financing Bill and Social Health Insurance Bill 2023 will effectively result in the dissolution of the National Health Insurance Fund.
So we are separating the functions of the NHIF as we transit to the new entity, so that the old bad practices of the current NHIF are not transferred to the new entity. And there is separation of functions to make sure that each person have, each entity, the new entity, is able to perform what it is strategically supposed to perform.
The 4 bills will be tabled in Parliament.